presentation on health literacy and hospital readmission. I'm Chantel Cruz. I'll be your presenter today. Feel free to ask any questions at any time. Let's begin. Overview. Our learning objectives. We're going to learn today what a definition of health literacy is, the statistics, how to reduce readmissions, effective communication, and patient education. Learning objectives also. By the end of the presentation, the participants, you all, will be able to name at least 2 methods of effectively communicating with the patient. Understanding medication errors and the cost, as well as being able to define health literacy. Definition of health literacy. Health literacy is a term that describes how well a patient understands his or her health and medical information, which in turn leads them to making appropriate health decisions. PICO. In adult patients that are discharging from the hospital, how do discharge instructions at a 5th grade reading level using the teach-back method compared to standard discharge instructions to the patient affect their medication adherence, decrease readmission rates and behavioral status 30 days after discharge? And for those of you who don't know what PICO means, the P is for patient population, the I is for intervention or issues of interest, the C is for comparison, the O is for outcome, and the T is the time frame. Do you have any questions at this time? Okay, we'll keep going along. Statistics. I would like for you all to look at this little picture here and get in your head, because I'm going to ask you what you think this picture means to you. On to the statistics. Were you aware that 14% of hospitalized patients are readmitted within 30 days of being discharged? The Affordable Care Act requires the Centers for Medicare and Medicaid Services to penalize hospitals for excessive amounts of readmissions in comparison to expected levels of readmission. Over 1/3 of the American population do not have the necessary skills to understand health information, make healthcare decisions, or even follow medication instructions. Readmissions overview. Higher rates of readmissions become quality of care issue at many hospitals and health systems. Readmissions are contributing to the high cost of care. Nearly 1 in 5 patients are readmitted within 30 days of being discharged. Analysis of Medicare claims data shows 75% of these readmissions are preventable ones. Excessive readmissions are costing CMS $17.5 billion annually. CMS ruling in 2009 to make readmission rates publicly available as a way to incentivize hospitals to pay more attention to care coordination had little effect on reducing readmissions. In fact, readmission rates went up as hospitals had no financial incentive to reduce readmissions. Again, we just went over some of this in the previous slides, but were you aware that the Affordable Care Act program began in October of 2012? At that time, $1.9 billion of penalties had been accumulated. In the fiscal year alone of 2017, $528 million of penalties were accumulated. A lot of this here is due to medication errors. Over a third of the patients were taking medications not even a part of their med rec. More than 25% of the patients didn't even mention the medications on their discharge list. Even over half of the patients were taking medications that didn't even match up with the ones on their discharge list. A lot of these things are avoidable readmissions. Failure of the healthcare system to effectively communicate with the patient. Improper education to the patient. Home transition not safely performed. Avoidable readmissions cost Medicare almost $18 billion in excess spending, according to CMS. Now I'm going to tell you how to reduce readmissions. I know you're liking this part here. So you can reduce readmissions by using a standardized health literacy precaution with all patients, no matter the level of education or literacy. You can also use the Maslow hierarchy of needs. Can anybody tell me what that is?
It's just the basic need of what someone needs as like a foundation to survive.
Correct. Thank you for that, Ms. Sindra. In assessing the patient's understanding, you can use the teach-back method. Each visit, you should present the patient with no more than 3 major of their healthcare issues, the major points for them to understand, because we know when you're going in the doctor's office, you're already being overwhelmed, so all of that coming in, they're not going to grasp all of that and understand it. Make the forms simple and offer to help in filling the forms out. Don't assume about their level of literacy and their preferred language. Ask. Check to see if the patient understood. Effective communication. Use clear communication strategies. Use everyday recognized words. Speak slowly and break down information into small, manageable steps. Again, check to see if the patient understood. Patient education. Teach-back method, demonstration, medication education. That concludes our slide presentation. We have a YouTube video. You can gather your thoughts while I go ahead and pull up the video. If you have any questions, you can ask them at this time. Now, we are going to take a look at the YouTube video.
He puts me on there and I just take it. Okay. Anything he tells me to take, I'll take it.
Okay. So you trust him?
You better believe it, my life.
Research has shown that many patients have a hard time understanding basic medical instruction. 26% didn't understand when their next appointment was scheduled. 42% didn't understand instructions to take medication on an empty stomach. 86% couldn't understand the rights and responsibilities section of a Medicaid application.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension and I've been taking care of that for a long time.
Hyper. Hyper.
Like you're hyper? What does being hyper mean to you?
That's well, you can't be still, you always gotta be doing something.
Do you think I think you're hyper? You have hypertension?
I don't know. That's what I consider it.
Okay.
To be it, you know.
But you know you have high blood pressure.
Mm-hmm.
Okay. But hypertension doesn't mean the same to you.
Mm-hmm.
So if I ask you if you have hypertension, you're going to just think, I think you're jumping around on the chair or something like that. Something different.
Just being hyper, you know.
Okay. All right. Well, teaching you what hypertension is. Because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing. Yeah.
Low health literacy impacts patients in all aspects of the healthcare system in many ways. In financial terms, patients with low health literacy use healthcare services more often and increase healthcare costs by an estimated $50 to $73 billion every year. The cost of patients can be equally high.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed every way they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it.
That concludes our slide presentation, our PowerPoint presentation. And our references. So, after looking at this YouTube video, what do you think?
First, I want to say that was an amazing presentation. Some things that we're not aware of when we're educating our patients. Sometimes when you have so many patients, you're just trying to get them out and get things done and go on to the next and prepare for your admission that's going to be coming. So, us slowing down and saying, hey, okay, do you really understand this information? Because like she said, she was 31 years old. She went in. We don't know if she had kids prior to that. And now they done did a whole hysterectomy. And they didn't ask, did she understand, like you made your points in your video saying, do you understand? They didn't make sure she understood, and now she could possibly have never had kids at all. So it was good, very informational.
It's a very scary thing. So I have a couple of questions, not a lot. I don't want to hold you guys too long. So, patient population intervention or issue of interest, comparison intervention, outcome, or time frame.
What is Peacock?
Yes, very good, very good. Okay, next question is, describes how well a patient understands his or her health and medical information, which in turn leads them to making appropriate health decisions.
What is health literacy?
I'm sorry, say it again?
What is health literacy?
Yes. All right. You guys were paying attention. That's awesome. So do you have any questions for me?
No, we just want to tell you thank you. You did an awesome job.
Well, thank you so much. I have an evaluation form and a couple of questions also at the end for you guys to do. So I just want to say thank you all very much. Thank you. Thank you.